We're joined now by Mr. Princewill Okorie, who is the National President, Association for Public Policy Analysts. Thank you for coming on this morning.
Thank you very much.
First of all, give us a background. You're in touch with several groups on behalf of the management of FMC Okorie, is that correct?
Yes, I'm aware of what is happening at FMC Okorie, not really being in touch with all the groups. I head Association for Public Policy Analysis. We have our office in Owerri, Imo State. We got involved on FMC matters from 2012 when we carried out evaluation of capital budget implementation in federal health institutions in the southeastern states. And this Federal Medical Center Owerri was the best. The Federal Medical Center Owerri was the best because as at that time, the projects that were in the budget, they executed them. The medical director that has this problem with them now never knew we were doing that. We got the budget document, we extracted all the capital appropriations that were made for all the federal medical health centers in the southeast. And we went to them one after the other. She was the most transparent. When we got to her, she said we should go to their public procurement unit and fiscal policy department. We went there with them. They showed us their books. We looked at their projects. And they executed them.
So as at that time,
yes,
had this crisis started?
No, it hasn't. It hasn't. In fact, as at that, it was DFID that funded that project. We did. And when we unveiled our findings, the Honorable Minister for Health then directed this medical director to come and represent him at the unveiling of that event. Now, a few years, that was 2012. Last year, 2015, we began to hear about all manner of things that were happening there. We went to the place, we met the union, and we asked them questions about what was happening. To our surprise, well, government has to be careful with the level of unionism we have now. We see unionists being people that are fronted to destroy people that are doing well. I am saying this with all manner, all sense of responsibility.
Now, how do you mean? Because
what I
the
mean
workers there are up in arms against the management.
They have a hidden agenda.
The workers?
Yes. They are not genuine.
What is the agenda?
Their agenda, if you watch the trend of events that have been happening in FMC, their first argument against their medical director was that she wanted to privatize the place. And when we went to them, they said she wanted to privatize the place. We are not asking them, how did she privatize? They said she wanted to sell the pharmacy unit. She wanted to sell the laboratory unit. We went to her. She said that some drugs get expired in the pharmaceutical department, whereas some people sell drugs there. How come that the center will be acquiring drugs for treatment, and the drugs will be there, somebody else is selling drugs, and the ones that were acquired by the center will expire there? In the laboratory unit, yeah. She said the capital funding they received was little, and because of that, they had to try to see if they could bring in PPP, bring in private sector to come in and fund the laboratory and make their money. And they wanted to introduce the same to the pharmacy so that nobody will go and bring his drug again and be selling while the ones they brought will remain there.
Well, we can't confirm that yet because they are not here to validate that. But are you aware of what was said? Because you just heard Mr. Josiah talking about the case against her in court and how the EFCC also have a case.
That is the reason I say they behave as if, number one.
Is that true or not?
I don't know about that. Bear in mind that health sector is a very essential service. The BOB is talking about the civil service rule. Has it bothered about the Imo citizens that are dying in their numbers? Is it justified that health workers will come to work and gather themselves outside the wards and be praying and be singing and be saying their medical director must leave? When we heard about this issue, we went to Abuja because we heard that President Jonathan gave a directive. An interministerial committee was set up to investigate the woman on all the allegations they brought up. It was headed by Minister of Labor. The person that was in charge of that investigative committee was a staff of Minister of Labor. We met with him and he showed us their report. He said that committee, head of service of the Federation had a representative, Federal Minister of Health had a representative, the unions had a representative, FMC had a representative. But to our amazement, they came out and said the woman was exonerated of all the allegations. that she should even be praised for being creative enough to sustain the place.
Did the same NLC make a representation in that
They
case?
were there. They were, even the man talking there now was there. I'm surprised. After the whole people met and gave judgment, they now said they had a minority report of only 2 persons out of about 9 persons that were in that committee. And they were called to make presentations. They made. After they made their presentation, and the ministry came up, the committee came up with a position that the woman should be allowed to do her work. The next thing, the ministry did not even reinstate the woman. They asked her to proceed on leave and set up interim management committee. Couldn't that have been another avenue to create a very good opportunity to assess whether she was doing well or bad? But within the period of interim management committee, go there and see. Our people are dying in their numbers. All the generating sets that were working when that woman was there are no longer functional.
Why?
I don't know. Management. Before she left, they had 4 ambulances. Now no one is working there. Go there and find out. Now, is the chairman of this union, why is Johesu National not reverting to Johesu Imo State? The man talking now is the national president of Johesu. Where is the state chairman of Johesu? Is it not proper that the national chairman of Johesu should relate with the Imo State chairman of Johesu on this issue?
Isn't that happening?
It's not happening at all. What? FMC Johesu relates direct with the national Johesu. What is their interest in that place? Now, this man is talking about, we in our association, when we went to the center to investigate, we met with interim management. Do you know that as we are talking now, the internship, the doctors that were supposed to do their housemanship didn't hold their exams. Right now, doctors wouldn't have their housemanship there. The medical lab science people wouldn't be doing their internship there. The state of that center is deteriorating.
You know, listening to you, and because it's amazing, because I have had the privilege of getting to watch all of these happenings on television since the time of President Jonathan, the talk of the pharmacy, and the laboratories, the argument of or accusation that she was going to outsource it. That was the word they used at that year, I recall, that she was going to outsource it to someone. And now how it has changed from that to management and a couple of other things. Since you have carried out your own findings and you have also done your own assessment of facilities around that axis, and now we're here where we are, what do you think is the crux of the matter? Since we have had issue of outsourcing, we have had issues of management and mismanagement, and since she's been cleared and back, and we still have the same issue with FMC Okorie, what truly is the matter?
The issue here is that the Johesu National want to team up with FMC Johesu and twist the federal government against that woman. They seem to have a personal agenda in that center. Otherwise, why will EFCC go to court without the Federal Minister of Health knowing? And when we found out when we came up with our findings, we wrote the Secretary to Government of Federation. We wrote the Head of Service of the Federation. We wrote the Minister for Labor.
But are you aware of the Civil Service rule that states when you have a case in court, you stand down in your position?
If there is civil service rule in that regard, the Head of Service of the Federation should know. The Secretary to Federal Government should know. And when we wrote them, they asked for various documents that we had the privilege to have. We supplied them.
You wrote who? The Head of
We
Service?
wrote the Head of Service of the Federation. Our association wrote them. We also wrote the Secretary to Federal Government. We wrote the Minister for Labor. We wrote the Minister for Health. We followed them up. At the end of the day, these letters, I'm telling you, we wrote them about 4 months ago and followed up. Remember, the interim management was supposed to expire by July. After July, till now, they were there until just a few weeks ago when they now reinstated this woman. When we were asking the minister, they said they wanted to be sure that they did what was proper.
So what's the place of NLC here? Because the NLC
we met with NLC.
Also spoke
we
on this
met
matter.
with NLC, Imo State, and TUC. We are a civil society organization. We have no personal interest. Our issue is that if you check Imo State, the health policy in the state now, the governor said he was privatizing the health centers. He said it was concessioning. And then the general hospitals also had the challenge of this concessioning. So having medical care was a problem in the state. And as people that are analyzing policies, we know FMC is the only tertiary health institution in the state.